Good afternoon and welcome to today's edition of Diplomatic Passport, your daily weekday COVID-19 show that keeps you up to date with Zimbabwe's COVID-19 effort, preparedness, as well as regional and global trends. My name is Blessing Munatsi, and this program is brought to you by ZTN in partnership with the Ministry of Information, Publicity and Broadcasting Services. And we start by taking a look at the latest figures released by the Ministry of Health and Childcare yesterday. 50 new cases of COVID-19 were recorded from 2,194 tests that were conducted, and this represents a 2.3% positivity rate and takes the number of active cases to 1,158. A single death was recorded, bringing the cumulative fatalities to 4,660. Effectively, it means less than 8 deaths were recorded since the weekend over until Thursday. And the cumulative number of COVID cases now stands at 132,487, and of these 126,000 rather, 669 being recoveries. And Zimbabwe currently has 92 hospitalized cases of COVID-19, 5 being new admissions, 14 asymptomatic, 59 with mild to moderate symptoms, while 14 of those admitted to have severe symptoms and 5 are in the intensive care unit. Going to the vaccination program, 9,808 people received their first dose yesterday, and this brings the cumulative for the first dose to 3,224,394, while 14,212 received their second dose to bring the cumulative for the second dose to 2.5 million. So 2.5 million people fully vaccinated, and just over 23,000 people receiving their jabs yesterday. Of course, government is saying that they will revamp and try to bring the momentum and bring the numbers of vaccinations, daily vaccinations, that is, back to figures that range above 50,000. Okay, let's move on to India, one of the countries that has been affected by the coronavirus, largely due to its high population as well as high overcrowding in the country. India has administered to date 1 billion doses of the COVID-19 vaccine so far, and officials have confirmed that the new figure marks a milestone for the South Asian country, where the Delta variant has fueled a devastating wave of the virus earlier this year. After a slow beginning in the middle of January, India's vaccination campaign has covered 3/4 of its 944 million adults with at least one dose, but only 31% of those have received both jabs. And the government wants all adults to be vaccinated this year. All adults must be vaccinated. That's their target. And the country, which has a population estimated at around 1.4 billion, is the second to distribute more than 1 billion doses after China did so back in June. And India halted exports of vaccines in April as cases at home surged and only resumed exports earlier this month. And of course, this was officially due to the high demand for the vaccine that prompted them to need it back home. Now, although the vaccination campaign has helped control the outbreak of sorts, officials in India are still working around about a gap between those who have received the first as well as the second shots. But even when countries like India managing this feat, the story is a little bit different, with low-income countries who have only managed to vaccinate just above 1% of their population. And WHO's COVID-19 technical lead, that's Dr. Maria Van Kerkhove, emphasized the need to ensure that there is vaccine equity in the globe, saying that the unequal distribution only takes us backward in this fight against the pandemic.
Less than 1% of low-income countries have their populations vaccinated. And if we look at low and middle income countries, it goes up to about 25% or so. It's not enough. I mean, there are huge numbers of people who are vulnerable to developing severe disease and dying who do not have access to the vaccine. I'm not talking about refusing vaccination. I'm talking about not even having access to the vaccine. And this is causing people to die unnecessarily. You know, people who are some of the most cherished people in our populations And those frontline workers who are caring for and keeping people alive are dying unnecessarily. There is absolutely no way to sugarcoat this, and we shouldn't. We should be screaming from the rooftops, and every single person who has a role to play here to fight for vaccine equity should. So there are a lot of donations that are happening. There's a lot of work in place to increase production, but it's not happening fast enough. We need those vaccines shared now. We need countries to be able to purchase those vaccines now, not next year, because people are dying now. And so I don't think we can overemphasize enough. Our Director General has talked about this every day. We have many partners who are speaking about this.
Now, coming back home, we know that many aspects of our daily lives have been impacted in one way or the other by the COVID-19 pandemic, and key amongst them is the sphere of education, the education system. And we have seen that face-to-face interaction with teaching staff had actually disappeared with the non-resumption of face-to-face lectures, and this was no longer possible as the government was obviously trying to get on top of the situation in as far as controlling the COVID-19 pandemic. Tertiary institutions, however, have started to take back their semesters. They have commenced their first semesters around the country, and we seem to be seeing that face-to-face lectures are gradually coming back. And we did speak to the Permanent Secretary in the Ministry of Higher and Tertiary Education, Science and Technology Development, that's Professor Fano Tagwira, who did highlight that it is actually imperative that we embrace new ways of learning, as this is the new normal.
They're going to be face-to-face lectures? Yes, they will be there. We call it blended learning, where you will be doing face-to-face, you will be doing virtual, online learning. It's a blend of different modes of learning. When it's not possible for us to do face-to-face, and also because of social distancing, we can't bring everyone to campus at the same time. So some groups come to campus, others are learning virtually. They also come, and the others are leaving. And we have to, that's the new normal. We have to learn that we are not all going to be able to be on campus at the same time for 3 months of the year. We are going to meet for 2 weeks, 3 weeks, and we the new wave, the fourth wave, according to the experts, we expect it any time. It could come in November, December, which means even those who were doing face-to-face may have to now go back to virtual again, to online learning. So we must adopt blended learning, because it helps you to continue learning. If you say we'll wait until there's no COVID, then you may not be able to learn.
So blended learning is the way to go, according to the Permanent Secretary in the Ministry of Higher and Tertiary Education. And of course, the impact of COVID-19 would actually have a greater impact on the scientific projects, or rather the scientific subjects that actually require people to be having practicals at the institutions. But it can all be done, like he did highlight. Now, with the student, a sudden shift away from the classroom in many parts of the globe, some are wondering whether the adoption of online learning has been a positive shift, and how such a shift has impacted them. We spoke to a student at one of our tertiary institutions, the University of Zimbabwe, who had this to say about her experiences learning remotely.
There's been some attempts to follow the social distancing and all, but because of general, the classes are not big enough to allow proper social distancing, it becomes a bit difficult. Maybe just that we were not actually testing people and knowing their status, but yeah, I think it's been quite difficult, especially with the numbers in the class.
All right, that does it for Diplomatic Passport on a Thursday. Thank you so much for making us your choice. We're back again tomorrow, same time, same place. Do make a date with us, and this program is brought to you by ZTN in partnership with the Ministry of Information, Publicity and Broadcasting Services. My name is Blessing Munatsi. Till we meet again, it's bye-bye for now.